Question number 481. A nurse makes a home visit to a patient recently diagnosed with the chronic obstructive pulmonary disease, and which of the following should the nurse teach the patient about managing the COPD? So option A, recognizing the sign of impeding respiratory infection. Option B, limiting the fluid intake, minimize the bronchial secretion. Option C, correct technique to auscultate the lung field. And option D, importance of starting the antibiotic therapy. So option A, recognizing the sign of impeding respiratory tract infection is correct answer. Question number 482. A patient with COPD experiencing the frequent dyspnea. So which of the following exercise would teach the patient how to better control the breathing? So option A, lower side ribs. Option B, segmental. Option C, pursed lip. And option D, diaphragmatic. So option C, pursed lip breathing is correct answer. Question number 483. In evaluating the appropriateness of the various exercises enjoyed by a patient with osteoporosis, so the nurse would recommend option A, walking, option B, bowling, option C, sit-ups, and option D, golf. So option A, walking is correct answer. Question number 484. A child with asthma is experiencing the thick respiratory secretion resulting in increased work of breathing. So the best nursing intervention is to option A, encourage the fluid, option B, eliminate the dairy product, option C, decrease relative humidity of the room, and option D, have the child lay on the left side. So option A, encourage the fluid intake, will help to loosen up the respiratory secretion. So option A is correct answer. Question number 485. The nurse is caring for a full-term newborn who was delivered 5 minutes ago, and the infant Apgar score was 8 at 1 minute and 10 at 5 minutes. So which of the following has the highest priority? Option A, maintaining the infant in the supine position. Option B, assessing the infant reflexes. And option C, preventing the heat loss from the infant. And option D, administering the humidified oxygen to the infant. So option C, preventing the heat loss from the infant, is the next and important step. Question number 486. Which of the following can be used to determine if a prescribed pain management therapy is effective for a non-verbal patient? Option A, pap smear. Option B, face rating scale. Option C, Braden scale. And option D, Apgar assessment tool. So option B, face rating scale is correct answer. Question number 487. A patient with congestive heart failure with a severe peripheral edema has a nursing diagnosis of the fluid volume excess. So what are the two important nursing intervention we need to initiate here? So option A, diuretic therapy and intake and output. Option B, nutritional education and low sodium diet. Option C, daily weight and intake output. And option D, low sodium diet and elevate the leg when in bed. So option C, daily weight monitoring and intake output is correct answer. Question number 488. A mastectomy patient has developed the lymphedema of the left arm. So the nurse should teach the patient that best position for his arm is option A, immobilized across the chest. Option B, dependent. Option C, elevated. And option D, interaction. So option C, elevated is correct answer. Question number 489. A patient is seen in the emergency room for a 20 centimeter laceration to the right forearm, and the course preparation for which type of anesthesia to be administered before the laceration is repaired by the physician. So option A, intravenous. Option B, regional. Option C, journal. And option D, local. So option B, regional is correct answer. Question number 490. A nurse is caring for a patient who just had a chest tube inserted due to the spontaneous pneumothorax. An appropriate goal is that the patient will option A, be free of pain within 4 hours. Option B, report decreased pain. Option C, rest quietly. And option D, sleep with few movements. So option C, rest quietly is correct answer. Question number 491. Which healthcare include the health maintenance and health promotional activities? So option A, primary. Option B, secondary. Option C, tertiary. And option D, rehabilitation. So option A, primary is correct answer. Question number 492. In community, a diagram of the family relationship with the external environment is called. So option A, eco map. Option B, genogram. Option C, map of the family. And option D, none of the above. So option A, eco map is correct answer. Question number 493. The most important and most basic technique in preventing and controlling the transmission of pathogen is option A, hand washing. Option B, cleaning the article. Option C, discarding the article, and option D, clean with cotton swab. So option A, hand washing is correct answer. Question number 494. Burden of disease is best detected by option A, disability adjusted life year, option B, Sullivan's index, and option C, IMR, and option D, survival index. So option A, disability adjusted life year is correct answer. Question number 495. Disability adjusted life year expresses the option A, extent of disability in the population, option B, expectation of life free of disability, option C, year of life lost to premature death, and option D, none of the above. So option C, year of life lost to premature death is correct answer. Question number 496. The epidemic occurring every 3 years is called option A, secular trend, option B, annual disease, option C, cyclic trend, and option D, pandemic. So option C, cyclic trend is correct answer. Question number 497. The endemic disease means that a disease, option A, occurs clearly in excess of normal expectancy, option B, is constantly present in a given population group, and option C, exhibit the seasonal group, and option D, is prevalent among the animals. So option B, is constantly present in given population group is correct answer. Question number 498. In a community, an increase in new cases means option A, increase in incident rate, option B, increase in prevalence rate, option C, decrease in incident rate, and option D, decrease in prevalence rate. So option A, increase in incident rate is correct answer. Question number 499. The case control study are used for. So option A, study of common disease, option B, finding the multiple risk factor, option C, finding the incident rate, and option D, finding the relative risk. So option B, finding the multiple risk factor is correct answer. Question number 500. The concept of health promotion and the related activity leads to option A, better treatment, option B, awareness and changes in the lifestyle, option C, adoption of prophylactic services, and option D, use of health services. So option B, awareness and changes in lifestyle is correct answer. Thank you.